Hello, welcome to today's lecture on communication. Clay Sharkey said, when we change the way we communicate, we change society. Today, we will discuss the importance of good communication in an effective team. How do we know communication is an important part of teamwork? During the 1970s and 1980s, several aviation accidents occurred. It was found they were caused by crew communication problems. The crew members included various members of the team, such as flight attendants, gate agents, dispatchers, maintenance, and air traffic controllers. Similar to healthcare, each of these specialties has specific training and roles that frequently contribute their expertise at different times in the flight process. Research was launched to determine needed improvements and training programs that would improve crew communication. The data confirmed that communication errors that caused the accidents involved vague hints at problems, unclear terminology, and problems with hierarchy. The hierarchy errors included the inability of one crew member to get the attention of a senior crew member concerning a serious safety issue, and there was not time to correct the problem. While healthcare and aviation are very different industries, there are many similarities between the two. Both industries rely on teams of highly trained professionals who perform very complex tasks. Both environments are high energy and require frequent updates. Little time may be available for making important safety decisions and taking action. Workload, stress, and interpersonal conflicts may complicate team function. And finally, the consequences of human error for both industries can be catastrophic. Therefore, many of the training tactics used in aviation have been adopted in healthcare. Improving team communication in healthcare. Similar to aviation, a recent study of adverse events in an ICU department has identified team communication failures that are leading to patient harm. For example, nursing staff is reluctant to speak up when observing an error, and then the error is not corrected or resolved for similar future problems. As we discussed in the last module, healthcare teams tend to be quite hierarchical in nature, with doctors usually having higher status than other healthcare professionals. This tends to result in a large power gap, where team members who perceive themselves as being of lower status feel as if they have nothing of value to contribute. However, if you have worked to become an expert in your area, then you have a great deal of value within the team. Every team member is responsible for situational awareness. Situational awareness is knowing what is going on around you. There are three distinct levels of situational awareness. The first level is perception. This involves being aware of critical factors such as patient vital signs or lab values. The second value is comprehension. This is an understanding of what those critical factors mean. This would be an understanding of what levels are normal for the vitals. The third and highest level of situational awareness is projection. This is used when the understanding of the critical information is used to predict what will happen in the future. This could be considered the diagnosis or an anticipation of a potential problem. To have situational awareness, providers must have a strong knowledge base related to their specialty to assure they can perceive, comprehend, and project within their area. No one is expecting a sterile processing technician to know what a surgical technologist does. However, we do expect the sterile processing technician to work towards mastery of their field. So a sterile processing tech should be able to obtain the time and temp an item was sterilized at and understand if the time and temp meet the requirements for sterilization. And then they should be able to predict if the item will be appropriately sterilized or if it will need to be run again. If each member of the team has situational awareness in their specific area, the team will be able to coordinate many individuals within different roles, different training, differing experience, and even different perspectives on care. Communicating our own situational awareness effectively within the team allows concerns to be heard and suggestions to be designed. There are 4 components of communication: the sender, the message, the receiver, and feedback. The sender delivers a message through verbal or nonverbal means with an individual or group. The message is the information. The receiver gets the message and decodes it with respect to the receiver's knowledge, background, and environment. And then feedback is information that is sent from the receiver to the sender regarding the message. It's very important confirmation that the proper message was received. It may be necessary for the sender to request feedback by asking if the receiver understands what was conveyed. In other words, this sender is going to call, let's say this is a surgical technologist calling down to sterile processing saying, I need a laparotomy tray stat. If this receiver does not understand that, the receiver should send feedback that says, I'm sorry, can you repeat the message? Or I didn't understand what you're asking for. The sender will send that message again, and then the receiver decodes and should explain that they understood the message through feedback. Receiving the correct message may be difficult based on background noise or communication barriers. Here are some communication skills for the sender when delivering a message of any kind. This would include suggestion or voicing a concern. Always speak respectfully and professionally. Stay within your scope of practice and area of expertise. Remember, you have worked hard to be considered an expert in your area. You should not communicate judgment or criticisms in areas in which you were not trained. Make your contribution only as informative as required. Do not contribute more than necessary. Always tell the truth. The patient's well-being depends on it. And use positive body language, such as smiling, eye contact, and unfolded arms. Confirm the receiver understands the message by asking, do you have any questions? As the receiver, one should use effective listening skills. Effective listening skills include making eye contact. This shows the sender that you are attentive and focused on what the speaker is saying. Be receptive. Be open-minded and objective about what your coworker is saying. He or she may be providing important information related to a patient's care. Show sensitivity. Think about your response. Respond in a positive, sincere manner that does not belittle or condescend. The receiver should give feedback that confirms the message was correctly received. This could be done by simply repeating the information back to the sender. If unsure of the message, do not walk away. Ask the sender to repeat or clarify the message. Although we may do our best to use appropriate team communication, it will be inevitable to find ourselves in some form of confrontation within the work environment. Our next module will discuss what to do if you find yourself in a confrontation and how to resolve issues in the workplace.